Okay, good afternoon, everyone. My name is Gina Downs. I'm the Vice President here at Senior Connection, and I really appreciate you joining us for our webinar this afternoon. This should only take about 45 minutes, and we're going to do question and answer at the end. And I think once we go through it, most of the questions that you have will get answered, and we'll just get started from here. Now, Senior Connection is a insurance agency. It does sound like a dating agency, but we are an independent insurance agency that helps people who are coming onto Medicare understand what it is, how it works, and all of that good stuff. We are not affiliated with the federal Medicare program or with Social Security, and there is no agent or agency that is. And if they tell you that, they are mistaken, or the words they're using just might not exactly mean that. I have heard agents say they work with Medicare, but what they're saying is they work with Medicare insurance, not Medicare the agency. And there is quite the distinction there, but that sentence can be misleading sometimes. And this is going to be an informational webinar only. We're not going to be talking about any specific companies and their specific plans. That would be more of a sales seminar. And this is educational. So we're going to talk about the plans that are available, but not which companies have which plans and their specific products and prices. With Medicare, that is the federal program that is offering your medical coverage to you, your medical and hospital coverage. It's available at 65, or if you have been awarded it due to disability. Now, if you have been awarded disability, you usually have to be disabled for 24 months before Medicare will kick in. The exception to that is if you have end-stage renal disease or ALS, which is Lou Gehrig's disease. And there are some exceptions for terminal cancers. People have been awarded disability early for that, and they don't have to wait that 24-month time frame. Now, Medicare is run by CMS, which is the Center for Medicare and Medicaid. Benefits are controlled by Congress, which means it would take an act of Congress to make changes. Nothing happens overnight. It takes a very long time for the government to make changes on anything. Social Security is who you're going to talk to when it's time to enroll in Medicare. And that is often confusing because people want to delay their Social Security enrollment because they're maximizing their Social Security benefit. But it's the Social Security Administration that is going to enroll you in Medicare. And that's why you have to contact them. You can enroll in Medicare and continue to delay your Social Security election should you want to. Now, Medicare is broken down into multiple letters. Part A is your hospital. That is your inpatient hospital stay, the skilled nursing facilities, hospice, and limited home health care. You have earned this premium free through your working history or your spouse's working history of at least 10 years or 40 quarters. If you haven't had that time frame, let's say you have immigrated to the United States and you're a legal citizen and you've worked 8 years, you can continue to work those 2 extra years and get that Part A premium free. If you had to pay for Part A, the monthly premium, I believe this year is $422 a month. So it's definitely a great benefit through your working history that you do not have to pay for that. With Part A, you have a deductible per stay in the hospital. It is $1,408 per stay when you're at the hospital, inpatient hospital. If you go in this first quarter, well, I guess we're now in the second quarter, if you go in the second quarter as an inpatient and are released, you go home, 60 days later, you have to be readmitted to the hospital as an inpatient. Even for the same or similar condition, you have a new benefit period, and now you have to pay that deductible again. So this is your first area of exposure with Medicare if you only have traditional Medicare. If you have to go to a skilled facility following an inpatient hospitalization, Medicare will cover the first 20 days, and you are responsible for a copayment for days 21 to 100. Now with Part A, to qualify for a inpatient stay, you have to meet certain criteria. You can't just request to be admitted as an inpatient. There are guidelines they have to follow, and there's a 2 midnight rule or a 3-day. It's honestly the hospitalists have a hard time clarifying it because many people don't understand it. The hospitals themselves and CMS, there's a lot of room, there's a lot of wiggle room in there. And so there is confusion on that, but you have to be in the hospital for a specific time frame. And basically it's 3 days that you have to be in the hospital as an inpatient. And after that, if you're in a skilled facility, Medicare covers it. Home health care is very limited. It has to be skilled care when you're in the limited home health care. So occupational, speech, and physical therapy provided at home are that skilled care. But when people are coming home from the hospital or a nursing home stay, a skilled nursing stay, what they're really needing is custodial care to help with bathing and transferring, toileting, light cleaning around the house, or maybe grocery shopping and things like that. That is custodial care, and Medicare does not pay for that. You would have to private pay for an agency to come in and do that for you. It is the skilled care that Medicare will provide that coverage to you. Hospice care is provided all under Part A, and it can be in your home or at a facility. Now with Part B, that's the medical side of it. Doctor visits, lab work, durable medical equipment, outpatient services, and surgeries. If you are going to the doctor, that falls under Part B. Now Part B is premium based. And most people in the nation, the vast majority of people in the nation, are in the standard Part B premium, which is $144 per month right now. The Part B deductible is actually $198, so there's a typo there. It's $198. But the Part B deductible is annual. It is often split up over multiple doctor's appointments or doctor visits. So you're not going to pay that $198 all up front, whereas the Part A deductible, you do pay that all at one time. Personally, I'd rather have that $1,400 split up, but they don't ask my opinion. Nobody cares about that. Now, after your deductible is satisfied, Medicare is going to pay 80% of approved charges. Their 80% is unlimited. If the charge is approved and you need that service, they're going to pay 80% of it, whether the bills are totaling $100,000 or $1 million. But what that means is your 20% is also unlimited. This is your largest area of exposure under traditional Medicare, is this 20%. 20% of an office visit is not very much money, maybe a couple $100s, but 20% of a knee replacement or a hip replacement could be thousands of dollars. You've got the surgeon's fee, the anesthesiologist, the surgical center, your rehab, the durable medical equipment, so your walker or wheelchair, whatever mobility device you need during that time. All of that has a 20% co-insurance, and that is one event for the year. So that is why this is your largest area of exposure. This is the area that could cost you the most money. And we're going to talk about ways to mitigate this cost. But 25%, 20 or 25% of the nation only has traditional Medicare. So everything else they're just paying for out of pocket should they need those services. Now the monthly premium starts at $144.60 if you are a higher income earner. If you earn more than $85,000, no, this year it's $87,000 as an individual, or $170,000 as a couple filing joint tax returns, then you will have a higher Part B premium. That premium will adjust if your income adjusts. Social Security is looking back 2 years on your tax return, on your adjusted gross income. 2020, they are going to be looking at your 2018 tax return. So if you were over those thresholds in 2018, then it's likely that you're going to pay a higher Part B premium. Now, you can appeal that decision. For example, if you sold some property and had an increase in your premium or income, a increase in your income, and it was a one-time thing, it is possible that they will bring your Part B premium back down to that standard level. Everyone that I have known that has appealed that decision, that higher Part B increase, they have won, meaning they get to pay the standard Part B premium, not that higher amount based on their personal circumstance. So if you are going to fall in that higher level, and it might be just a one-time reason for you having a higher income, I would say it's worth the time to appeal that decision. Now with Medicare, the coverage is nationwide. If the doctor accepts Medicare, then you can go to them. The caveat to that is, are they accepting new Medicare patients? If you are established with a doctor and they accept Medicare patients and you turn 65 or go on to Medicare later on, you can continue to see that doctor. If the doctor retires, oftentimes they already have a plan, a succession plan in place for another physician to take over their patient load for them. So that's an easy transition. If the doctor passes away suddenly, then you're going to have to find a new doctor that can take you on. And they must be accepting new Medicare patients in order for you to go see that doctor. We don't run into that very often here in Evansville. Very rarely do we have trouble with clients being able to find doctors that they can go to, that they want to go to. It's not that you're just stuck with somebody, but you can usually find doctors that are accepting new Medicare patients. And nationwide, we've not seen too much of an issue with that, particularly if you're going to Vanderbilt or Mayo Clinic or MD Anderson down in Texas. They do accept those Medicare patients, so you can go down there should the need arise. Now with Medicare Supplements, you might have heard of these. They are also known as Medigap plans because they are literally filling in the gaps of Medicare's exposure. These are voluntary plans that you're going to purchase separately, or you could purchase separately, to fill in the gaps of Medicare. You're going to have a premium for these plans. They are lettered, so the plan letter is going to dictate your benefits. Now, because these are standardized plans, it does not matter which company is offering the Medicare supplement. If the plan letter is the same, the benefits are exactly the same. The premiums are all over the map. So with Medicare Supplements, this is your option on plans that are available. Right now, if you turn 65 this year or sometime later in the future, your plans available are A, B, D, G, K, L, M, and N. In the past, plans C and F were available. But if you are not 65, if you were not 65 on January 1 of this year, those plans are not available to you. So you might have friends that are on Medicare that have a plan F, and you will not be able to buy that ever. Well, I guess unless the government changes the rules, but you will not have that availability. The great news is the plan G is the most comparable plan to it, and it is significantly cheaper. It is about $300 to $400 cheaper per year than that plan F. The only difference in benefits is under the plan G, you are responsible for that Part B deductible. So that $198 deductible, you are responsible for that. After you have satisfied that deductible, paid that deductible, you have 100% coverage nationwide. If Medicare approves the charge, your supplement follows behind it with their responsibility. If you go to a doctor that accepts Medicare, your supplement follows in behind it. No questions asked. There are no networks that you have to be aware of. It's nationwide coverage. Things that Medicare does not pay for. That's a question I get asked often. Well, how do I know if Medicare is going to approve the charge? One, it's always good to ask first. If there's any doubt that Medicare is not going to cover it, ask the provider, ask their billing department to verify your coverage before it happens, because afterwards, good luck getting that charge reversed. Oftentimes, Medicare will not cover blood work that is non-necessary. If you ask the doctor to run blood work for thyroid, let's say you just want to check your thyroid, unless you are having symptoms that would lead your doctor to believe you're having a problem with your thyroid, Medicare is not going to pay for it. The test has to be diagnostic. They need to be looking for something specific. Now, if you have a current condition or you're under the guidance of your medical professional, you have high cholesterol or blood pressure or diabetes, Medicare is going to cover that. They're going to cover those exams. They're going to cover the diagnostic testing and checking up on that because it's an ongoing treatment. They're not going to pay for exploratory things just because you want it. There has to be a reason behind it. And then Medicare will cover it in very, very most instances. And then your supplement's going to follow in behind that. Now, let's see. You have Part C, Part C is Medicare Advantage. These are private insurance companies that you're going to contract with on an annual basis. They contract with Medicare on an annual basis. They have to provide the same types of services that Medicare is. They just do it in a different way. They have lower monthly premiums. These are the plans that you see on TV that are $0 premium, $0 copayment, $0 drugs. There is always a cost. If it sounds too good to be true, it is. You have to be aware of how these plans work. That does not mean that they're bad. Not by any means. There are fantastic Medicare Advantage plans out there, but you just need to understand how they work because they are different than traditional Medicare. Now, with a Medicare Advantage plan, you've got HMOs, which are health maintenance organizations. They are the most restrictive kind of care because it's in-network only. If you go out of network for a non-emergency service or non-urgent need, then you will have no coverage. You pay 100% of the charge if you go out of network with an HMO. With a PPO, you have in and out of network coverage. You can go to an out-of-network provider. It just might cost you a little bit more. So instead of a $5 copayment for a primary care doctor, it might be $30 for that primary care visit. Now, you also have a private fee-for-service option. That is similar to a PPO in that you can go to any provider that will accept the terms of the plan, but you must verify that they will accept the terms of the plan every time you go. So just because they accept it this month does not mean that they will accept it next month. There's a little bit more work for you on that side of it. Personally, I'm not down for that. I don't want to have more work to do with my insurance. There are great PPO options and HMO options out here, and I want less work if I have to have it. Your plans, these Medicare Advantage, they have co-payments for almost all of your services. Co-payment for doctor visit, co-payment for lab work, co-payment per day in the hospital. All of your co-payments are going to add up to an annual out-of-pocket limit, which could range between $4,800 for the year, all the way up to $10,000 if you go out of network for those services. So you do have some flexibility there. You're not guaranteed to spend that money, but if you use the plan, then you're going to be spending some money. Now, the fourth part of it is the drug plans. Just remember Part D for drugs. These are your outpatient prescriptions, drugs that you are self-administering, your cholesterol medicine, your high blood pressure medicine, your diabetic medication. If you are taking it self-administered, it falls under Part D. If you are an inpatient in the hospital, then your medication falls under Part A. But all the other times, it's going to fall under your drug plan. These plans have premiums for them, and they have tiered copayments. Now, the big thing with drug plans is that they are voluntary. You don't have to have a drug plan, but if you do not have a drug plan and you do not have other credible coverage, you are going to be penalized in the future when you enroll in a plan. You're going to be penalized 1% of the national average premium per month. For example, if you, and this year that penalty is about 36 cents a month. So if you go without a drug plan for 1 year, let's say for 2020, you go without a drug plan, you're going to pay about $5, just under $5 per month additional to your monthly premium. So you'd purchase a plan that has a $20 a month premium for your drugs. Because you have that $5 penalty, you're going to pay $25 a month for the year, each month for the year, for your drug plan. The following year, you enroll in a new drug plan, and let's say it's only $15. You still have that $5 penalty, so you pay $20 a month for that plan. The penalty will stop growing, but it stays with you for life. We've got clients that take no medication or very low cost medication, and they have a drug plan just in case because they don't want the penalty and their medication could change. So they have it just in case. And then we've got clients that take no medication or very low cost, and they don't want a plan. It's cheaper for them to self-insure on the drugs, and they will assume the risk in the future should they need a drug plan. So we're not going to tell you what you have to do. We just want you to understand that if you delay or if you do not enroll in a drug plan at the time that you can, then you will be penalized. Now, the ways to avoid that penalty, if you have other credible coverage, if you are eligible for the VA, you don't have to use the VA, but if you are eligible for the VA, you have to sign up with them, and then that will avoid any late enrollment penalties in a drug plan. If you have retiree coverage available through your employer that includes credible drug coverage, then you don't have to have a drug plan. You can avoid that penalty. If you are working past 65 and you have group coverage that is credible, you avoid that penalty. When you retire in the future and you lose that group coverage, that's the point in time when you will make your elections for your Medicare coverage, and you will not have penalties because you've had that credible coverage. With the drug plans, you can have it as a standalone drug plan. So that would go with your Medicare Supplement and traditional Medicare. Or you can have the Medicare Advantage plan with an integrated drug plan. Those are called Medicare Advantage prescription drug plans. So it's all in one. The standalone drug plans, there are 28 different standalone drug plans that are available this year. Every single one of them is different. They all cover drugs differently, and they all have different formularies, and they all have different premiums. Their formulary is their list of covered drugs. No plan covers every drug. So when we're looking at your drug plan, we want to know what your specific medications are. Because unless you're taking the same thing as your spouse or your neighbor, just because they like their plan doesn't mean it's going to be a good fit for you, because you have different needs. You have different medications. It's very specific to what you need. So we're looking at that every single year because these plans change every single year and they can change throughout the year. Now, if you've known anybody that's on Medicare, you've probably heard of the donut hole, or if you've done any research, you've found out about the donut hole. What the donut hole is, it is a point in time where the cost of your drugs has reached a specific threshold and your cost sharing will shift. When the full cost of your drugs is just over $4,000 at any point during the year, then you will go into the donut hole and you pay a higher cost sharing. Now, that does not mean that you have spent $4,000 on your drugs. That means the total cost of your drugs has reached $4,000. If you fill your prescription and have a $10 copayment, but the actual cost of your drug is $100, it's that $100 that is applying to that threshold of $4,000. If you have insulin, if you are insulin dependent, oh man, don't get me started on insulins, but they are ridiculously expensive. And most of our clients, when they're on insulin, aren't taking just one insulin. They have two. They've got a fast acting and a slow acting insulin. Each of those insulins full cost are between $600 and $800 each per month. Those people get to the donut hole very quickly because of that full cost of drugs. Now you're going to be in the donut hole until the total cost of drugs has grown from just over $4,000 to $6,300. There's a big jump in cost, or that threshold gets expanded. So a lot of people this year go into the donut hole, but they don't get back out because the government has pushed that time frame to get out so far out. If you take a handful of generics, 6 and under, you're not going in the donut hole. Generics are inexpensive. It's very, very unlikely that you're going to go into the donut hole if you have generic drugs. If you are on 2 or 3 brand name drugs, you are going in the donut hole. They are just so expensive, and the plans are pushing everybody to get off of brand names. And sometimes you can't do anything about it because a generic is not available. And that's why it's very important to review that drug plan every single year to make sure that you are not spending more than necessary on your medications, because these drug plans are not doing anything special for you. You are truly just trying to find your lowest cost estimate on your drugs from year to year. And if the government could make any part of Medicare confusing, it is the drug plans. So if you are completely baffled by the drug plans, you are not alone. The more you hear it, and once you enroll in Medicare and go through it at least a year, it will make more sense. Right now, there's just so much information that you're being exposed to and is getting thrown at you, and it's overwhelming, honestly. But once you've gone through it, it really isn't that bad. You just want to review those drug plans from year to year. So probably why you're on here today is, do you actually need Medicare? If you're still working, maybe or maybe not. If your employer has less than 20 employees and you are going to continue actively working, yes, you need Medicare. Medicare will be your primary insurance and your group will be your secondary. If your employer has more than 20 employees and you're going to continue working, you may be able to delay your enrollment in Medicare. Most of the corporations, most companies that I have spoken to that we work with, we've got clients from all over. If your employer has more than 20 employees, it's very likely that you can delay your Medicare enrollment. And the reason this is important is because there is no reason to spend $144 a month for insurance that you're not going to use. You can enroll in Part A, and most people do because it's premium free. but delaying that Part B enrollment is what you want to consider. Now, you want to talk to your HR department or to the benefits people in HR and find out how they coordinate with Medicare. Do you have to enroll in Medicare, or can you delay the enrollment? Once you are retired and you are no longer an active employee, then you will need to enroll in Medicare. That's the time frame that you want to enroll in Medicare. And Medicare would request 2 to 3 months in advance for your enrollment. And we're going to come back to that in just a minute. But if any of you are contributing to an HSA, a health savings account, if you are going to work past 65 and you want to continue contributing to your HSA, you cannot enroll in Medicare, A or B. If you are enrolled in Medicare and you're contributing to your HSA over 65, the IRS could penalize you for those contributions. And if your employer is also contributing, you can be penalized on that too. And a lot of employers do not know that rule because their HSA administrator is the one who's supposed to be staying on top of that. So if they've not told you that, it's not because they're trying to hide something. It's just that they most likely don't know that that's a thing, that that's a rule. Now, if you have a husband and wife and you are contributing to an HSA for both of you, with HSAs, you have the ability to have an individual contribution or family. So it's husband and wife or an individual. If one spouse is aging into Medicare and they want to enroll, their portion of the contribution has to stop. But you can continue to contribute for the younger spouse. You drop your contribution maximum to the individual threshold, and that way you avoid the penalties. Both people can use the funds that are in the HSA, but the contribution level has to change. I know enough about this to be dangerous, so I highly encourage you to talk to your HSA administrator to make sure you understand the timelines and the amounts that you can contribute if you have an HSA. Now, there are HSAs, which is the health savings account. You have a flexible spending account that does not fall under these rules. You also have a HRA, a health reimbursement account, that does not fall under these rules. It is only the HSA that falls under these rules. And last year there was a bill that went into the government to reverse this rule because it's ridiculous. But I don't know where it's at this point with all the new changes that are happening across the country. I don't know if it has been stalled. I have not seen any new updates that they have made changes to this, but we had expected that they would have a decision sooner than later, but honestly, I don't know where that's at. Okay, when you're enrolling in Medicare, if you are going to enroll in A and B together, you can do it online through the Social Security website, and I highly recommend that you do that. It is very easy to do. It takes about 5 minutes. If you are already drawing Social Security prior to age 65, you will be automatically enrolled in Medicare. You don't have to contact Social Security to get your Medicare card. They will automatically send you your Medicare card 3 months before your 65th birthday. So let's say you turn 65 in November, then October, September, August is when you are going to get your Medicare card, and it's going to have A and B on your card. In November, when your Medicare starts, they will automatically deduct your social or your Medicare premium from your Social Security check. It's out of sight, out of mind. They automatically take it out of your Social Security check if you are drawing Social Security. If you are someone who is going to delay enrolling in Social Security, but you need to enroll in Medicare, then you have to contact the Social Security office and let them know, because they won't just automatically send it out. Again, you can do that through the Social Security website, ssa.gov. You will need to set up an account, your My Social Security account. You are not enrolling in Social Security. You're just setting up the account. You're going to get out of your My Social Security account and you're going to go back to the main Medicare or main Social Security page, their home page, and there's going to be a button for enrolling in Medicare. You click on that, follow the prompts, print off any confirmation that you receive. That way, if they have a computer glitch, you can show them on May 13th, you enrolled in Medicare and here's your confirmation number. Medicare would request 2 to 3 months in advance for your enrollment. That way they can get everything processed and get your cards mailed to you. If you are someone who is delaying your Medicare because you're going to work past 65, you can enroll in Part A online because it's premium free. The caveat to that is if you're contributing to the HSA. When you want to enroll in Medicare in the future, you have to contact the Social Security office and you have to do it in person. Now, right now, they're closed and everything is done by phone and by fax. But you have to send in paperwork to them to show them that you have had credible coverage for however long it's been since you turned 65. There's going to be a page that you have to fill out with your information, and there is a page that your employer has to fill out. If you need that paperwork, it's online, but if you need it, we can email you that document so you can get that to your employer to fill out. Do not set up your appointment with Social Security and go to that appointment without that paperwork. Otherwise, they're going to tell you, you have to have this paperwork and reschedule your appointment. They won't get anything done. You have to have it when you're going to talk to Social Security to make sure that things move along as planned. Now, let's say you're drawing Social Security and you're automatically enrolled in Medicare, but you don't need it because your spouse is working and you have group coverage through them. When you get that Medicare card, there's going to be instructions to tell you you can mark a line through Part B and mail the entire card back to Social Security. They will reissue a new card with Part A only. That way, you're not charged for Part B when you don't need it. So if you're drawing Social Security and you're automatically enrolled in Medicare, but you don't need it because you have group coverage through your spouse or yourself, then you're going to mark a line through Part B and mail the card back to them. Those instructions are on the card when they send it out to you. So, which way are you going to go? There's no best option. It's what you feel is in your best interest, what you feel is going to meet your needs. One way is with traditional Medicare, a supplement, and a standalone drug plan. You have your Part B premium for Medicare. You're going to have a higher monthly premium for your supplement. That premium range, if you are a 65-year-old female, is going to be between $100 to $150 per month for your plan. If you are a 65-year-old man, it's going to be about $110 to nearly $200 per month, depending on which plan and what company you go with. You're going to have your premium and your co-payments for your prescription drug plan. Under this way, you're going to have 3 cards that you hold on to. 2 for your medical coverage and 1 for your drug plan. Nationwide coverage. You have your deductible on your medical, that $198. After that, it's basically 100% coverage for approved charges. Every year that you are on Medicare and a supplement, your Medicare supplement premium is going to increase. Now, oftentimes you are going to get an age increase, which is about $3 per year as you get older. But you're also going to get a general increase. So everybody that has your plan in your area is going to get a percentage of increase. A modest increase is 3 to 8%. Those aren't bad premium increases. We like to get 3 or 4 years out of a plan before the premiums have taken so many increases that you can save money going somewhere else, going to a new company. So let's say you start off with Mutual of Omaha, and 4 years from now, their premiums are high enough that if you sign up for Cigna, you can save $50 a month. Well, right now, when you're coming on to Medicare, you're guaranteed issue, pillar of health or on your deathbed, and you can get the supplement that you want. In the future, when you want to change your supplement, you're going to have to answer medical questions. And the new company that you're applying for, they can say no. They can deny you. Your guaranteed insurance is Medicare. Those supplements that you're applying for are a voluntary plan. They can say no. Now they're looking for if you've had a heart attack within the last 2 years. Have you had a stroke in the last 2 years? Do you have emphysema or COPD? Do you have any cognitive disorders, Alzheimer's, dementia, those types of things? Some events are time specific and some are knockouts. Have you ever had it? And when you're working with your agent, you don't have to necessarily tell them that all at the same time, but it's a good idea to, so that they can make sure that they understand your situation and you get all the information you need to make the best decisions for your future. Now, let's say you had a heart attack and you want to change your plan. Well, that time frame is 2 years. So you reach that 2-year mark, you apply for the new company. It's still not guaranteed it's going to go through, but you meet all the qualifications. You've been able to answer all the questions, and they accept your plan, and now you have this new Medicare supplement with a new company. So that's one way you can structure your coverage. The other option is Medicare Advantage. You're still going to pay your Part B premium for Medicare. Whether you go with a supplement or a Medicare Advantage, you have to pay your Part B premium, that $144. Now with a Medicare Advantage plan, you could have a $0 premium plan. You're going to have co-payments for your services. Now those services are only paid for as you use them. You could save thousands of dollars if you don't go to the doctor or you don't have any medical events. If you have a bad year, you could spend thousands of dollars. It is risk assessment. With Medicare Advantage plans, you have networks of doctors. So when we're looking at that, we want to make sure that your providers are in network so that should you need to see them, your cost is as low as possible. Your out-of-pocket exposure remains low. These plans have those drug plans included, so you're going to have co-payments for your drug plans. Now, the co-payments that you're paying for your prescriptions do not apply to the annual medical out-of-pocket limit. Your medical co-payments do not apply to getting you into or out of the donut hole. They are two separate sections within the same plan. The Medicare Advantage plans do have dental and vision integrated in there. So that's why you also see them advertising the dental and vision plans. They offer some dental and vision coverage. Overall, none of us get excited about dental or vision because it's just not fantastic. It's just not great coverage. Oftentimes they have a limit every plan actually has a limit on their dental and vision, how much they're going to pay for your services. And that's usually about $1,000 for the year that they're going to give you towards those services. And you're going to have percentages of copays or co-insurance to coordinate with that care that you have. So there is some caveats to that. But the Medicare Advantage plans and a few of these supplements include gym memberships, such as silver sneakers. We get questions on that often. The silver sneakers. There are Medicare Advantage plans that have that, and there are a few Medicare supplements that have that. So you do have those options on either side of there. But overall, there's no best plan. There's no best way to go. It's what you feel is in your best interest. As time goes on with Medicare Advantage, if you want to change your plan, do you have to answer medical questions? No. Yes and no. The only question that's going to keep you out of changing your Medicare Advantage plan is if you have end-stage renal disease. If you have end-stage renal disease, your options are going to be very limited. The government just opened up a few plans that allow for end-stage renal disease, but if you have end-stage renal, you have limited options. But anything else that's going on, they're not going to deny you any of those options there. You can go from United Healthcare Medicare Advantage to Aetna or Humana to United Healthcare. Every single year, you can change those plans. And the only question that keeps you out is that end-stage renal disease. Now, let's say you want to go with a Medicare supplement to start off with, but in the future, you decide, I want to go with Medicare Advantage. You can do that during the annual enrollment period. Every October 15th to December 7th, you have the option to change your plan. And that can be to the Medicare Supplement, Medicare Advantage, or vice versa. Now, if you're going from Advantage to Supplement, you have to answer medical questions. The one time that doesn't happen, the medical questions don't apply, and you don't have to wait for annual enrollment, is the very first 12 months that you are in a Medicare supplement. The very first 12 months you're in a Medicare Advantage plan. If for any reason you do not like the plan, you can go to traditional Medicare, a supplement, and a drug plan, no questions asked. The very first time you're in a Medicare Advantage plan, you have a trial period. After that 12 months, then you can do it during annual enrollment, and you have to answer medical questions to go back to a Medicare supplement. These are the enrollment periods that are available. When you are turning 65, that's called your initial enrollment period. It's the 3 months before, the month of, and 3 months after your 65th birthday. Now, when you are turning 65, if your birthday is the 2nd to the 31st of whatever month, your Medicare starts the first day of your birth month. If you are born on the 1st of the month, then your Medicare will start the month prior. So if you're a July 1 birthday, then your Medicare will start on June 1st. If you are a July 2nd birthday, then your Medicare starts July 1st. So you have those enrollment periods. Every year during annual enrollment, you can change your drug plan or your Medicare Advantage plan. And you will see an uptick in mailings and TV advertisements during this time. If you're turning 65 or getting close to right now, you are being inundated with information. I mean, your mailbox is probably full of junk, and that is what it is. It's just junk. They're just trying to entice you to purchase from them. A lot of the junk mail is scary because it says, act now or you're going to lose out on your benefits. If you don't do something now, you won't have coverage. All they're trying to do is scare you into calling them so they can sell you a plan. You have time to make decisions. You don't have to necessarily rush into your decision. unless you're someone who waited till the very last minute, and then you might have to make a quick decision. But for the most part, they're just trying to scare you. Now, when you are retiring after 65, or if you move, if you go into a skilled facility for a short term or a long term duration, you have what's called a special enrollment period. And you can make changes based on that time frame and for those specific reasons. And then every year we have open enrollment where you can change your Medicare Advantage plan from one Medicare Advantage to another. Really, the reason people do this during open enrollment would be, let's say they enrolled in a plan during annual enrollment, or they didn't change during annual enrollment because they liked their plan. But then after the first of the year, they find out that their doctor is no longer accepting the plan, or the plan is not covering a drug anymore. They want to change their Medicare Advantage plan and go somewhere else to a different Medicare Advantage plan. That's the time of year they could do that if they did not do it during the annual enrollment right beforehand, right before that. So these are the enrollment periods that you have available to you. If you or someone you know has trouble paying for their prescriptions, you've got high cost medication, and even if it's not high cost, it's just you don't have the money to pay for it, extra help is available. It is through the Social Security Administration, and it helps you pay for your prescription drugs. If your income and assets are very low, Medicaid may be an option for you. Medicaid is a beast all unto itself. We do not get involved in the enrollment on that. So we would refer you to SWORCA to help get that application process completed. And once you find out if you've been awarded or denied Medicaid, then we can come in and find out, is there anything else that you need to go along with that? But we just don't. Medicaid is a very complicated system, so we do well to stay on top of Medicare. That's enough for us at this time. These are my staff members. I need to put Janet Murphy on here. She's the one that you most likely spoke to, she or Pat, when you called in to get registered for our webinar. Cindy, Audrey, and Henry are our salespeople. So they're the ones who are going to explain the Medicare Supplements and the Medicare Advantage to you. Brenda, Parker, and Lainey, they are going to explain the drug plans. They're my drug plan experts. So that's who's going to talk to you about what drug plans are available and the cost there for you. If you need additional resources, we've got our Facebook page. We've got our YouTube page. This webinar will be uploaded to our YouTube. We've got other videos on our YouTube. So if you want to come back and rehear this information, because I know as soon as this is over, you're probably going to brain dump it all. It's just going to be gone because there's so much. I won't be offended. It took me so long to learn this information and be able to retain it and share it so that somebody else was able to understand it. So don't feel bad if you are overwhelmed. Come back, hear another seminar, schedule an appointment with one of our agents, and they can give you specific information to your needs and your costs so you can make those informed decisions. If you are trying to decide whether you want to, even if you're working and you've got group insurance available, it might be financially advantageous to come off of the group and go on to Medicare. We can help you look at that. We can give you those prices and let you know. We're not just about the education. We definitely want to give you that education, but we can sell you the plans as well. We are what's called a broker. So we can look at all of the companies that are available: United Healthcare, Anthem, Humana, Cigna, Mutual of Omaha, people you've heard of and people you haven't. We've got it all available. You don't have to do the shopping on your own. You don't have to go somewhere else. You don't have to call a 1-800 number. You can call us, and that's what we're here for. And that's what we want to do for you. And we stay on top of it. So every year we can review it. And if you want to review it, then we can be here to help out with that.